Welcome back to another episode of Vetsplanation, everyone. Today, we have a treat for all the cat lovers out there. Joining us again is our favorite feline specialist, Dr. Černá. She has been busy with her new litter of kittens, and we've been loving all the adorable photos she's been sharing. But more importantly, she's here to share some invaluable tips on how to make vet visits less stressful for our beloved cats. From preparing at home to finding the right vet, we've got a perfectly packed episode for you ahead, so stay tuned because you won't want to miss a minute of this. Also, don't forget to like and subscribe. All right, welcome back to another episode of Vetsplanation, everybody. I'm really excited. We have our crazy cat vet back today. She's had some kittens that we've been seeing pictures of, which I absolutely love. But we're going to be talking about how we can best take our cats to the vet and like how we can like really prepare cats at home before we even get there and how to prepare them to just see the vet in general. How are you doing, Dr. Turner?
Hey, I'm actually doing really well. I just managed to vaccinate my 6 kittens at home on
Oh,
my own today.
oh, that
I
is
know,
that is
right?
impressive.
And all distal right front limb. So I was
Wow,
actually pretty impressed.
that is really impressive, actually, especially for
And
kittens who wiggle a lot.
yes, yes. No, I fed them breakfast. They were all very hungry and pretty distracted. And yeah, it was good. So they actually didn't have to go to the vet, but we're already starting to practice for when they move to their new homes. They are actually set up for success, right?
Perfect, exactly. So when we decide we're gonna actually go and take our pets to the vet, you had just mentioned how they're gonna be going to a new home. How do you decide how to find a vet then before you even have your pet?
Yeah, I think that's very hard, right? Because my cats are very lucky since I'm a feline,
Right.
since I'm a crazy cat vet. So they are very lucky. However, I specialize in feline medicine. So I still need, for some things, a vet for my cats, right? Because I don't do surgeries, I don't do dentals, and so on and so on. And I'm very picky. So my cats actually
Right.
have a personal cardiologist, they have a personal dentist, they have a personal surgeon, and so on and so on. So I am very picky with how I choose vets for my personal cats as well. And I think it's really, really important that we actually are, because it is very important for the cats not to be stressed, and try to find
Right.
someone you trust and someone the cats feel comfortable with as well.
Well, what do you think about finding somebody through the fear-free website or
Yeah, absolutely. And I'm feel free certified, but I actually enjoy a little bit more the AAFP or ISFM, actually feline friendly certifications, because they are very much focused just on cats and being cat friendly. So the fear free is great. And I think it is definitely better than nothing. But it also, of course, those people are trained also to be fear free with dogs, because even though I do not work with dogs, I think it's still very important that our canine patients get the best care that they can, and they can be stressed at work at work, at my work, so it means
yeah.
hospital as well. But yes, so you can actually look online and go to the Fear Free website, or ideally even to the AAFP, because there are actually a lot of crazy cat vets that they don't even see dogs. So if you actually go to that practice, there will be no dogs anywhere for the cats to smell, for the cats to hear. And that's really exciting. But of course, it doesn't happen everywhere. But if you look at the Fear Free website or the AAFP, the feline friendly professional website as well, you can actually find clinics in your area that are trained to work friendly with cats, and they are interested to do their very best for the cats.
Mhm. So can you explain to me real quick, like fear-free versus the AAFP?
Mhm. Absolutely. So they're actually both great options. So what does it mean being fee free or the feline friendly kind of certified? Means that those vets, and usually it doesn't just go to the vets. Usually most of these places also have veterinary technicians that are trained, but also will have other professionals like receptionists and the support staff that have been trained to handle animals in a fear free or this feline friendly kind of way. So we are being very proactive, because we more and more appreciate how pets get stressed when they come to the vets. And we, of course,
Right.
want to do our very best. And I can tell you the vet visit already starts at home. And there are so many things people can actually already do at home before they even come to the vet. And I always try to, because I actually give a lot of lectures on this topic too. And first slide of my lecture is like the vet visit starts at home. So we need to really do our best already at home. So we are setting up our cats and us too, right? Like
Right.
I hate seeing my patients, also my cats being stressed. So it brings absolutely to nobody joy when those patients are not enjoying the life.
Absolutely. So, what are some of the things that we can do to try to help our cats at home before we even decide on the vet visit?
Absolutely. So I think one great thing is actually trying to teach the cats to be used to the carrier. Because, of course, if the cat only sees the carrier twice a year to go to the vet, it's not going to work out great. So these days, they are actually selling these like soft carriers that are even they can be made into beds. It's really actually
Oh,
fascinating.
cool.
I work with this one rescue and they have these carriers at home. They are not cheap, I can tell you that. However, they are little beds at home, so they can sleep in them at home. They smell like them and they feel very comfortable with them. And they completely close on the top. So what you do, like when the cat is sleeping in, you can just close it on the top and actually see, how the cat would react when she's at
Mhm.
home or he's at home. And then when we actually bring them to the vets, it's super easy for us too, because we can open these carriers on the top so we don't have to drag the cats out. We don't have to
Right.
wait for 30 minutes for the cat actually to come out. And
Right.
it's just so much easier. So also getting a good carrier. I've
Mhm.
actually had a lot of clients over the years when they came with these very old carriers that you couldn't even open it because the screws were gone. So they actually had it taped
Zip
and
tied?
stuff. Yeah,
Yeah.
zip tied,
Yeah.
exactly. And I literally, after the first visit, told them, if you show up with this carrier again, I am not seeing you and your cat. And I'm like,
It's so
seriously?
hard. Yeah.
I know, but it was breaking my heart to see how
Mhm.
stressed that cat was. It
Right.
sometimes when they also get very anxious, it is not even safe for them or my staff or me to actually even trying to get them out. And it gets to a point where it's breaking my heart. It's causing me stress. It's causing my support staff stress. It's causing the cat so much stress. And then they go home, they pee themselves on the way back and everything. So really
Right.
having a good career is just like the best investment ever. So I actually provide, if my clients show up with these careers, I actually provide them with a list of careers that I really like to work with. And not all of them are crazy expensive. So it's really just to
Right.
have something that is safe for the cats. Actually, the other day I had a client who brought her cat in and it was see-through on three sides. The cat came
Mhm.
in and respiratory rate was 80 because the cat was seeing all the dogs, everything that
Right.
was happening. And I was like, next time, please just put a blanket over him or over the carrier because this is really stressing him so much. Or
Yeah.
people are bringing these cats in these backpacks, right? There was the movie about it. So now
Right.
everybody's buying these backpacks with these like windows. And I'm like, this
With
is not
the big globe in it. Yep. Mhm.
exactly, because it was in a movie with a Scottish fold. Like we actually came with a huge statement how this movie should have never been even filmed in the first place because it's a
Yeah.
promoting a diseased breed and also really not cat friendly at all. So
Right.
I didn't even go to see it. I'm like, I cannot watch 3 hours or 2 hours of a movie
Right.
where this we are seeing this. So I can't believe like Hollywood has like billions or millions of dollars and they can't find a consultant when the movie star in the movie is a
Right.
cat. So
Yeah.
I was like shocked. I was like, can you please hire someone to actually tell you all the
You're like,
thousands?
"I'll volunteer." Yeah.
Exactly. I was like, I don't even
Yeah.
want to get paid for this. Just
Yeah.
please do not show this to people. But yeah, so I
Right.
could actually probably talk about careers for a very long time. And I've been through a lot of different careers and stuff. And I think it's really the crucial and number one important things for these cats.
So it sounds like our ideal carrier should be opens from the top. It's something that they don't see through or at least can put a towel over. What do you think about soft versus hard carriers?
Yeah, I think that's a great question. I think hard carriers are definitely safer and easier to clean because, of course, especially if you have to drive for a while to the vet, cats can have accidents, right?
Mhm.
You can have an accident in the car. The soft carriers are not always the safest carriers, unfortunately, because like sometimes they have these zips on the top and there's like a hole. So I've actually had cats escape from that as well. Cats are
Yeah,
smart, right? Like they will
right.
figure things out. So they might be a little bit more comfortable for the cat. So what I usually do, I usually put like a bed or blanket in my hard carriers, so it's more cozy and comfortable for the cats. But I think the hard carriers are a little bit safer when it comes going to the vet. But I actually have one type of a soft carrier that I go not to the vet because it doesn't open on the top, but it opens only from the side and from the front. But I take my cats to cat show there because the
Mhm.
cats I show, they are very easygoing. Like I open it and
Right.
they come out,
Just
and
walk
so I
out.
know exactly. But I do not use it to go to the vet.
Yeah. I have seen ones that are really cool that it does open from the top and the sides, but it has like this, like an extension to it. So it just makes it more roomy for them. So you can close the extension or you can open the extension up and it just gives them more room. I thought that was a really cool one as
Yeah,
well.
that's cool.
Yeah.
Most of my Maine Coon clients actually have those because the Maine Coon
Mhm.
cats are
They're
really
huge.
big.
Yeah, exactly.
Exactly. They actually have those that open up, so when they're, like, in the car, they have more space, and they only close it
Mhm.
up when they come to me, and I have to, like, literally move them from the front to the back, and
Right.
then we open it again when we get to the back. So, yeah, I think 3 or 4 of my, clients who have Maine Coons, they all have it. Yeah,
Nice.
I
I will
like
say
that.
one other thing with the soft carriers is I do also find that cats, when they get stressed, they also can roll the soft carriers, which is very dangerous because they can roll off of a table.
Yeah. Yeah,
I've had that
no.
happen to my clients. Yeah.
Oh, wow, yeah. Actually,
Yeah.
has never happened to me. Most of the times, like,
Ugh,
one time I actually had a cat who, like, threw up in it and stuff, and then I was like, we tried our very best to clean it, but it really needs to go to a washing machine at home, so
right.
it was quite hard. So I definitely am pro, like, hard curls with, like, soft bedding.
Yeah. Yeah, exactly. And then how
Mm.
long do you think the carrier should be left out for at a minimum before deciding to go to the vet?
Yeah, I can tell you from my experience, do not do it the morning off because you
Mhm.
will not see your cats that day.
Right?
So it has happened to me a couple times. So now I usually try
Mhm.
to put it at least a day before we have to go to the vet. And ideally, like sometimes, especially when you're teaching young kittens and stuff, I think even having it there so they can go in and out and use it as a play. That's what I'm doing now with my kittens. It's
Mhm.
definitely a good idea because my kittens now are at this phase. They're 8 weeks this week and they just like love to explore. So I'm
Yeah.
like taking every advantage. They even learn to explore the big litter boxes and stuff, So
Aw.
I'm just like using this advantage and like teaching them a lot of kind of cool things and tricks, like even the vaccines, right? We were doing the treats and I let them play with kind of the vials and the syringes
Mhm.
and stuff. So they actually came to me when I was vaccinating them because they're just so curious at this stage.
Yeah.
So I now we have like carriers and like other things like out, so they're getting used to it. Yeah.
Nice.
Yeah.
Nice. So now that we've gotten them in the carrier, what can we do to make them less stressed in the car?
Yes, that's also a great question. So definitely try not making phone calls in the car that are loud, not being upset, not like honking and screaming at other drivers, not listening to very loud music. Like imagine cats have really very good sense of hearing. So imagine if you listen to loud music or if it's very loud outside, it can be very stressful. They actually sell CDs with classical music for cats that's relaxing.
Nice.
So it might be one way to do, right? So
I
that's
think
what they're.
there's also a, Spotify playlist, if I remember correctly,
Oh, really?
for yeah, for cats. Mhm.
Oh, wonderful. Okay. I'm mostly playing it from a CD, but if it's actually now I have a Spotify, so I'm definitely
Yeah.
gonna check that one out. And yes, I think that so just trying to be cautious about what we are doing, trying not to drive too fast if we are going into those turns. Just try to be as gentle as possible. And I think some cats can definitely get car sick, and we have medications to help with that as well, if that's the case. And I think one thing I really want to mention is talk to your vets about potentially starting already medications at home. So there are medications you can give to your cats at home, like gabapentin. Sometimes I even do combination of like gabapentin and trazodone at home if the kitties are very anxious, and just giving it sometimes even the night before and then again the morning off, or at least the morning before the visit, at least 1 to 2 hours before, so then when they are actually in the car, they feel a little bit sleepy. It just makes the whole visit way less stressful for them as well.
Yeah. Do you recommend having them in the car and just driving around for, like, short car rides or anything when they're kittens and just help them to expose them to know that just because they're in the car doesn't always mean they're going to the vet.
Yeah, I think that's a very, very good thought. And I think potentially for cats that are not getting car sick and really like sick in the car, I think this would be one great way to do it. I now have a lot of clients who actually use these harnesses and they take their cats for walks and stuff.
Hmm.
So I think that's definitely one way to do it as well, that the cats know that sometimes they are going to go somewhere fun and it's not always car ride doesn't mean going to
Right.
the vet. But probably for those kitties that get really car sick, that might not be like it might be like stressful for them either way, just because that they get sick. So maybe doing like more medication treatments in those patients might be probably more helpful.
Okay. And then when they get to the vet, is there anything that we can do to help make them more comfortable while we're waiting?
Yes, that is also a great question. I love all of these actually. And yes, we should definitely. And this is where really looking for a good vet and a good practice helps a lot because cats, again, they have great sense of smell, right? They have a great sense of hearing. So those barking dogs, or like I've had one time a client who we usually try to put carriers at least at like where we sit, but ideally even having it the vet practice where you go to, having some shelves where people can put their carriers with cats safely so they are not at the kind of floor level, because cats don't feel safe on the floor, right? Because they are
Right.
predators but they're also prey in nature, so they do not feel safe at all when they're on the floor. Then those dogs, I had one time client put a carrier on the bottom and then somebody else had a dog that went and wanted to smell the carrier. And oh my god, like I just we could not even open the carrier. The cat was so anxious after that
No.
experience. I literally had to send them home and have them come back next week because
Yeah.
he was done with this visit.
Right.
So like my cats are not used to dogs. So then
Right.
some cats are completely fine with dogs, but it's maybe the dog they have at home. And they don't want to be friends with some other dog who's now there
Right.
barking and smelling differently. So even if your cat is friends with the dog at home, they might not want to be friends with the dogs that we see at the clinics.
Right.
And if they start barking, and it's just very stressful. So trying to find like a space that's as quiet as possible. We also provide towels that we spray with Feely. So sometimes this Feely Way sprays that owners can get them at home as well and just spray into the carrier as well, or really have a blanket that's over the carrier as well to try to prevent other smells coming in and the cat smelling other things as well. So there are actually so many things we can do to help them out rather than, oh, he's a carrier, we're going to the vet and that's it. So there are actually so many things we can do.
One of the things with the feel away is I do usually tell people don't spray it into the carrier while the cat is in it. Make sure you
Yes.
do it before, yeah, because I've definitely had a cat that had an asthma attack when somebody did that.
Yeah, absolutely. And also like it makes noise when you spray it. So
Right.
you definitely wanna I usually what I
Mhm.
do, I spray it and then I bring it and put it over the carrier.
Mhm. I also so at our clinic, we also have a feline only area. So it's not like the waiting room is a feline only area, but we have a space in the back that's only for cats. It's closed. It's very quiet. And I will usually ask people to like if we can keep their cat back there so that way it's not with a lot of other barking dogs and stuff. Do you feel like there's a problem with taking them away from their pet parent to be able to keep them in a much more quiet environment?
Yeah, and actually a lot of feline friendly or feline only practices do that. They
Mhm.
actually will take the cat immediately from the client and put it in a room where it's alone. I know it can be stressful for a lot of clients to be without their cat, but sometimes, especially if there are like barking dogs in the area,
Right.
probably this way is way less stressful for the cat. So we have
Mhm.
definitely done that as well. And CSU is actually undergoing now like big reconstruction. So I actually immediately be just like when they arrive, we already like expecting them. And I even
Right.
sometimes tell clients when they have very stressed cats, wait in the car, just text me when you get here, and we will just get you in and immediately take you out because
Yeah.
they're reconstructing the lobby and it definitely has been
Mhm.
pretty noisy on some days. So we are really working actively to try for these cats not to get too stressed.
Nice. And then what about during the appointment? Is there anything during the appointment that, 1, the pet parents can do, and then 2, some of the staff can do to help keep that cat as stress-free as possible?
Yeah, absolutely. So many things again.
Yeah.
So we always try to put, for example, towels on the tables, right? Because the tables can be cold, they can just might not be comfortable. And also sometimes people don't like this is like an interesting thing, but not everybody lets their cats like roam around and be on a table. I just have now
Mhm.
3 of my cats like crossing the table here
Yeah.
and there. Like my household, the cats have they set the rules. I do not
Right.
even try. You cannot do this. That
Yeah.
yeah, they
You live
train
in
me
their house. Yeah.
exactly. They train me well, but some people don't like cats on their tables or kitchen tables and stuff. And then suddenly we put them at tables in the hospital, and it can be stressful for them. They can be stressed also from the hard surfaces. So we try to always put towels. We usually pre-spray them with the Feely way, and then just being very cautious and like watching these cats because cats have amazing body language. I have never been bitten in my life by a cat because I can look at the cat and say, this is going to go great.
Yeah.
We need to do this, or this is not going to work out today. So
Yeah.
I really can tell because the way they put their ears, the way their eyes work, the way kind of their whiskers and muzzle shape as well. So there are just so many ways when we look at the cats to see how comfortable they are with us and how much extra caution we need to put into our work with them as well. We use churro treats. So yesterday I had 2 patients, and each of them run through 4 to 5 churro of these
Oh my
liquid.
gosh. Yeah.
So yeah, one even at the end was like a little bit burping because I
Mm,
was like, but it just makes them happy. So we
right.
usually try to do things with like when we need to draw blood and stuff. So we have one person like gently holding, and I from my experience, the less you restrain cats, the better. So we really I sometimes even have them lay on the table and lick the churro, and they're very happy. And things really have been working out really well. And then we have a third person who is then like drawing the blood. So
Yeah.
it's a person job, but the churro treats are just amazing. Cats are so food motivated, and we really underestimate that. I think often.
Mhm. Yeah.
Yeah.
Some of the things that I also have talked to pet parents about have been keeping them inside their carrier, especially the ones that can open from the top or come out from the top. So that way they just feel like they're in this enclosed space, not so scary for a lot of those
Yes.
stressed out ones. Yeah. Do you do that as well?
Yes, absolutely. All the time. I always say, actually, yesterday I had, because we now have, I have a couple of our DVM students who are on summer break. So they are actually
Mhm.
working with me through my clinical trials, and they are very excited to see my patients, of course, as
Nice.
well. So we actually had one yesterday, and one of the students was like, "Oh, how do you like the cat to be for your ultrasound?" And I'm like, "However the cat wants to be, because I
Yeah.
always work around my cats."
Mhm.
So whatever my patient wants, I work around them because I can do an ultrasound standing, laying, sitting, whatever works for the patient is always the
Mhm.
best way for me to do it as well. So I was like, whatever he wants. And so he wanted to sit and eat the churros. So that's how we
Yeah.
kind of did it. So I very often actually,
Mhm.
especially in these round carriers, they are just so soft and they just lay there, and I can do my whole physical exam there. Sometimes we of course need to get them out if we need to draw blood or potentially do neurological or orthopedic exams. So sometimes
Mhm.
we have to take them out of the carriers, but I've even have measured blood pressure and tapped a chest and abdomen in these carriers. So I've
Yeah.
definitely
Nice.
really done that and really try to work as much as I can around my patients. And
Yeah.
probably one thing I also never do. Yeah, I was asked yesterday by the student as well, and she was, "Oh, do you like?" Because I was like, "Do you want to take the temperature?" And she was like, "Yeah. How are you okay with like rectal temperature?" I was like, "No, never ever. I
Okay.
don't do rectal temperatures in cats. Always axillary." And she's,
Mhm.
"Aren't you worried about like how accurate it is?" And I'm like, "If I know this cat is here pretty happy on the table, I'm not worried that the cat's hypothermic and has low temperature and is going to die. Then that would be like maybe one time if I have a very sick patient where I'm worried that their temperature is low, I probably want to go and get a rectal temperature. But those cats are very sick or when they're anesthetized, right?
Yeah.
But otherwise, axillary temperatures are just so great in cats, and they usually don't mind when you do that. But when you do rectal temperature in a cat, they always mind.
Yes, yes.
Yeah.
I
Yeah.
unfortunately am the opposite because most of my cats that I see are very, very sick.
Yes. Yes. You have a hard job. I don't think
Yeah.
I can actually do that. I used to work until very recently, about once or twice a month in our urgent care. And yes, some of those that they come in,
Mm.
they are very sick. And that's, of
Yeah,
course, a different story, right?
yeah. But
Yeah.
even then, like, when I have very, very stressed out cats, I usually will ask people if we can give gabapentin to help calm them down, and then I
Yeah.
just give them an hour to chill out in the room that's very quiet, and then
Yeah.
come back and reassess them after that.
Yeah, and I think that's also great. I always prefer the gabapentin at home. I feel like it kicks in a little bit better and works a little better.
Mhm.
But yes, I really hate doing anything that stresses the cats out at work.
Yeah,
So
yeah. Do you have any other tips or tricks for us to be able to, like, help with the cats and their visits?
yeah, absolutely. I think, for example, if you have a picky cat, I think it's completely fine to bring even treats from home for us
Mhm.
to give, or if your cat is on a special diet,
Mm.
or for example, if they have a favorite towel or like favorite something that they like to do, I think it's completely fine to bring it with them. I always tell clients, especially if patients need to get hospitalized, you might never see this blanket ever
Oh,
in your life
yes.
again.
Yes. That's what I tell people too.
Clean things and everything. But yeah, so I've had some
Mhm.
that they just bring a new blanket every day and they're like, yeah, if we
Mhm.
never see this again, it's okay for us.
Nice.
But yeah, especially the treats, if they because we have the like the churro treats, we have some of the harder like temptations and like all of these treats, but there are some cats that they just love their one treat that they're used to at home. So
Right.
definitely you can bring treats from home. And I think really, I think I would really start with picking the good carrier and everything as well at home. And also trying to like schedule your appointment. And especially if you're going for the first time with your cat to the vet, just making sure, because sometimes I know everybody works, right? And but sometimes my clients are in a rush and I'm like, it's really hard to do what is best for the patients if I am like in a lot of rush.
Yeah.
Yeah. And then sometimes, if like just really being very thoughtful and proactive about even how you carry the carrier, right? So if
Mhm.
you're carrying in your hand and it's like moving, that's not nice.
Swinging.
Exactly.
Yeah.
Swinging. It's not nice for those cats either. So maybe I usually have either now these like trolleys are becoming like very
Oh,
pop,
yeah, they are really cool. Yeah, yeah,
they are becoming very popular. So those are pretty good.
yeah.
Or some of these, like just carrying it so the carrier is like supported from the bottom as
Mhm.
well. That is very helpful, I think, for cats as well.
Nice. What about the lighting in the room? Do you have dimming lights for your exam rooms?
Yes, we absolutely do. So we usually try to work with, of course, brighter lights because we need to see the patients, and sometimes we are looking for little things like on the skin or stuff.
Right,
But we
right.
always dim them for like ultrasounds, of course. But yes, we actually have dimming lights, and if cats get very anxious, especially when we have to sedate them, I always dim the lights and make sure everybody's very quiet in that time so the cats can just relax and chill. We also use a lot of these hiding boxes at the
Mhm.
hospital. So I actually have either when we have patients staying with us for a couple of hours, for example, getting an ultrasound or something like that, I either keep them in their carriers in the cages that we
Mhm.
have at work, or I am keeping them and giving them these kind of nice houses that we have. So
Yeah.
hiding space is very important. And I think maybe one more thing, it's very also important, like I mentioned, reading the body language, but cats can do this flight, freeze, or fight reactions.
Yeah.
And I think everybody always panics and does whatever they can for these cats that they would fight back. But
Mhm.
actually, the cats that freeze, they can be as stressed as the ones that actually are getting to this kind of fight reactions. And we shouldn't underestimate how stressed those patients are as well. So
Right.
the fact that the cat just sits there and does nothing doesn't mean that they are not stressed. So really watching the body language of these cats is very important.
Yeah, absolutely. Great. Anything else you wanna add?
I think no, I just would
Okay.
also maybe a last thing. Yeah, sorry.
Right.
One more thing. Just I want don't want people to get discouraged to take their cats to the vet, because we've covered that in the episode, like the last one and the one before, how important it is for the especially the senior cats to really
Yeah.
get the preventative care they need. So just trying to, and talk to your vet, really go out there, look for a feline friendly or the fear free clinic, and talk to them. Most of these places will be very happy to talk to people about visits as well. The cat clinics usually even block more time for work with cats than they do for dogs, so those are really good
Yeah.
as well. And just don't get discouraged, because it is really important, especially with our senior cats, that they really go and get their blood pressures checked, and that they get their annual, at least, blood work and all their exams done.
Yeah, and it doesn't mean just because your cat was afraid before that we can't implement all these things and maybe it'll be more comfortable afterwards.
Yes, exactly.
Yeah,
And I think also when you come back at home, sometimes then these kids go in hiding, and maybe just try to give them a treat when you come home and do something nice for them, or something they really enjoy, or give them their favorite meal, just to really try to motivate them and make them appreciate the visit. Oh, I went to the vet, but now I'm getting my favorite
yeah.
food. So maybe it's not as bad.
Or play with their favorite toy or something.
Yes,
Yeah,
exactly.
yeah,
Exactly. Yeah.
nice. Perfect. So I have a random question for you. Do you name your kittens before you adopt them out?
Yes, they actually, because they are all pedigree kittens. So they actually, I just had to submit their pedigree. So they all had names. So the boys in this litter are actually called, we have Kingdom of Heaven,
Mhm.
we have King Arthur, and King Speech. So the boys are all, because it's a letter K too. So they all have to start
Ah,
with the
okay.
name K.
Yeah,
And then the one girl, my favorite that I'm keeping, her name is Killing Me Softly. And
I
then
love it.
we have Kiss Me and Keep Smiling.
Cute.
Yeah, but most of them actually have their pet names. So Keep Smiling is, for example, Mandrake, because when you lift her up, she screams like the mandrake plant
Like
from.
the mantrake. It's
Yes,
amazing.
exactly. So she literally screams exactly the same
Uh,
way. Yeah, you should have heard her this morning when I was vaccinating her. But interestingly, she
uh,
like didn't scream at all when I was actually vaccinating. It was literally just when I hold her.
when you
She like
hold her.
constantly wants to run. She's like smaller than all the other kittens, because she never stops. She
Uh,
like always runs around and
yeah,
never wants to, like, the second you like stop her, she gets, I'm not doing this. I'm gonna run again. Yeah. So
yeah, that's
they
amazing.
all, yes, they all get their pedigree names, but then the people always, of course, give them like some pet names and
Right.
stuff.
What are you going to be calling your one you're going to keep, the Killing Me Softly?
I need to think about it. Right now, she's Miss Blue.
Blue. Okay. I was
Because
gonna say, are
yeah,
you just gonna short it to Kill Me or something?
yeah. No, she's very sweet. So we still need to do like a proper pet name, but now she's Miss Blue now. So
Mm.
she might just
Nice.
be Blue. We'll see. We'll see.
We
'Cause
we have a cat who his name is Little Red. So I mean, I
oh,
feel like you
okay.
could do that.
Yeah, so she might just be Blue, but we'll see. We'll see.
Nice. All right,
Yeah.
perfect. Thank you so much, Dr. Cherno. We really appreciate you coming on always and just all your wisdom that you have for cats. We love it.
Thank you so much. Yeah, it's been wonderful to be here, and I look forward to next time.
All right, sounds good. We'll see you then. All right. Thank you,
Bye.
everybody. Make sure to always keep your pets happy, healthy, and safe. Thanks, guys. And that wraps up another episode of Vetsplanation. We hope that you found today's discussion with Dr. Cherna as enlightening as we did. Preparing our cats for vet visits and finding the right care can make a world of difference for their health and happiness. Remember, a little preparation goes a long way in keeping our furry friends stress-free. Thank you so much, Dr. Cherna, for sharing your expertise and those adorable kitten stories. We can't wait to have you back on soon. And to our listeners, thank you for tuning in. Don't forget to subscribe, leave us a review, and share this episode with a fellow cat lover to help make their trip to the vet easier as well. So thank you again to Sean Heiberg for his editing and Kelly Dwyer for all of her work on our podcast. Don't forget to keep your pets happy, healthy, and safe. Until next time, we'll see you next week.